How can your amniotic fluid levels be raised by foods? Pregnancy can make it seem like there is always something to remember. Eat a balanced diet, take your prenatal vitamin, drink plenty of water, exercise frequently, manage your anxiety, sleep on your left side, and simultaneously pat your head and rub your abdomen. Okay, so that last one wasn't taken seriously. However, let's take a moment to be serious. Amniotic fluid is another issue you should be aware of. Your doctor will let you know if your levels are placing you or your unborn child in danger and will give you an advice on what to do next. It's crucial to follow their instructions. The amniotic fluid is the that your infant is surrounded by as they develop inside your uterus plays a crucial role in fetal growth. It is a worker because it cushions your baby kind of like a shock absorber, allows you baby to move, helps baby's body parts grow normally, keeps baby's temperature regulated, helps prevent infection. The umbilical cord is kept floating by amniotic fluid so that it doesn't get tangled between the infant and the side of your uterus. Let's first examine how amniotic fluid functions and possible causes of reduced levels, then we'll talk about what you can do to get assistance on your own and what your doctor can do. How exactly does amniotic fluid function? About 12 days after conception, your baby begins producing amniotic fluid. Amniotic fluid during the first trimester of pregnancy is composed primarily of body water. The amniotic fluid produced in the second half of pregnancy is derived from your baby's urine. As odd as that may sound, it's an essential step in your baby's development of their respiratory, gastrointestinal, renal, and urinary systems. Low amniotic fluid, oligohydroamnios, which is so critical to the growth of your developing baby, can be very worrying. What might be the reason for a low level of amniotic fluid? Low levels of fetal fluid can result from a variety of factors. These consist of premature membrane rupturing. This occurs when your amniotic sac, also known as your bag of waters, ruptures or starts to discharge before labor actually begins. Contact your physician right immediately. The placenta has issues. The placenta is essential in supplying your infant with nutrients and oxygen. Your baby might not be receiving enough nutrients to have adequate fluid or urine output of the placenta is acting strangely or has begun to separate from the uterine wall. Birth flaws. Low amniotic fluid can result from a baby's inability to produce enough pee, particularly if the kidneys are affected. Mom's health problems. Low amounts of amniotic fluid can result from maternal complications like the ones listed below: diabetes, elevated blood pressure, obesity, dehydration. Because of this, it's crucial to maintain all of your prenatal appointments, even if they have been relatively uneventful thus far. Pregnancy after term. After 36 weeks of pregnancy, amniotic fluid normally begins to decline, and after 42 weeks of pregnancy, it is very likely to become dangerously low. By that time, though, everyone will likely be so eager to meet the baby, particularly you, that having the birth force upon you will be more than welcome. Medications. Low amniotic fluid can result from some medications, particularly those used to manage high blood pressure. The ranges you are seeking: how can you be certain that you have low amounts of amniotic fluid? You probably already surmise that this calls for a trip to the doctor to determine whether there is enough blood. They can use an ultrasound. Using a technique known as the maximum vertical pocket, amniotic fluid is quantified using ultrasound before 24 weeks of pregnancy or in pregnancies with multiples. Your uterus will be scanned by an ultrasound technician who will attempt to locate and quantify the deepest pocket of amniotic fluid possible. 2 to 8 centimeters is a typical size cm. Low amniotic fluid at this time is indicated by a measurement of less than 2 centimeters. The amniotic fluid index, or AFI, is the most popular method of measuring maternal fluid after 24 weeks of pregnancy. The ultrasound technician will measure fluid pockets from four different areas of the uterus in addition to measuring the AFI precisely like the single deepest pocket technique. To obtain the AFI, these values will be added together. 5 to 25 centimeters is the typical AFI. Amniotic fluid is insufficient when the AFI is less than 5 centimeter. Let's get started solving the problem. Depending on the reason and your stage of pregnancy, the treatment for low amniotic fluid will vary. While some regions of low amniotic fluid are easily treated, others might need more extensive measures. Take more liquids. Water consumption can be very important at any point during pregnancy. Hydration is crucial for increasing uterine fluid levels in pregnant women between 37 and 41 weeks, claims one study. A coherent database review also discovered that simple hydration raised amniotic fluid levels, though more study is required in this area. What's appealing about this treatment? Whether you are pregnant or not, increasing your water intake won't do much damage. Amnio infusion, a saline infusion, is injected by your doctor through your cervix and into the intrauterine sac during an amnio infusion. It may sound unpleasant, but if your doctor feels you need this, it's well worth it. This can, at the very least, momentarily raise the fetal fluid level. Additionally, if your baby's heart rate is abnormal, it may be done prior to delivery to make your infant more visible on an ultrasound. Amnioinfusion is a successful therapy for enhancing the environment for a baby. If there is insufficient amniotic fluid, according to a review from the UNC School of Medicine, amniocentesis, a procedure used to inject fluid before birth. A small needle is used in amniocentesis to enter the amniotic sac through your belly. Your doctor might administer fluid via amniocentesis before you birth your baby if you have low amniotic fluid before or during labor. This may lessen your risk of needing a cesarean delivery by assisting your baby to keep their mobility and heart rate throughout the delivery. Intravenous liquids. Your specialist might advise intravenous fluids. This can be particularly useful if you need to hydrate more quickly and thereby increase your amniotic fluid, or if you are dehydrated as a result of nausea or vomiting. In essence, this is an additional method for supplying your body with the vital nutrients. Treatment of underlying issues. Treatment for underlying conditions like diabetes or high blood pressure, which may be the source of your low amniotic fluid, may raise your levels. This might entail taking medicine, keeping an eye on your blood sugar, or scheduling more frequent doctor's appointments. Managing the cause is beneficial for both of you because pre existing conditions may lead to additional problems during your pregnancy. Bed rest. In addition to not being as common as it once was, bed rest has never been well linked by those who have to endure it. However, some medical professionals will still recommend it in cases of insufficient amniotic fluid, except when using the restroom or taking a shower. Resting in bed or on the sofa may help the placenta receive better blood flow, which in turn promotes the production of more amniotic fluid. If you are in your second or early third trimester and your doctor wants to wait to deliver the baby, bed rest is most likely to be recommended. It's challenging, but make an effort to unwind now. Find the ideal Netflix program to binge on and let everyone wait impatiently for you. Extra vigilance. Your doctor might advise careful waiting if you are not yet 36 weeks along with the pregnancy. They will check on you more frequently and possibly run extra procedures to make sure your baby is healthy. These tests might include a non stress test in which stickers are put on your belly to track the occurrence of contractions and the heartbeat of your unborn child. Alternatively, you might require more frequent biophysical profiles, which are ultrasounds that measure the amount of amniotic fluid in your womb and the movements of the infant. Although it may sound frightening, additional surveillance has a few advantages. One, you get to spend more time with your child. Additionally, your physician will be able to address any problems sooner than later. According to some studies, eating a high fat diet while pregnant has a slight detrimental impact on the amniotic fluid levels, but only in animals. Furthermore, despite some rumors that the sugar stevia could be used to boost amniotic fluid, there is no evidence to back this up. In reality, some early research suggests that consuming artificial sweeteners while pregnant may actually increase your baby's chance of developing metabolic disorders later in life. The question of whether stevia is natural or manufactured adds to the confusion. Would you like to play it safe? You might want to just avoid it. Natural solutions. There is little to no evidence that using natural remedies will boost amniotic fluid aside from drinking more water. Even though there are websites and videos on the internet offering what they claim to be natural remedies, low amniotic fluid is a significant medical condition that, if left untreated, can have a negative effect on your unborn child. Your practitioner needs to take care of it and keep an eye on it. When possible, we are all in favor of acting normally. However, the stakes are too high to try an untested remedy. Delivery. First of all, congrats on your baby if you are at least 36 weeks along. Second, your doctor might advise having your infant delivered early. Although you might feel conflicted about it, babies born in the final month of pregnancy have fantastic outcomes. On the other hand, there are significant risks associated with maintaining a pregnancy without enough amniotic fluid. They could involve meconium aspiration, cord compression, or miscarriage. Your doctor will discuss the advantages and risk of an early delivery with you, but many babies are delivered preterm or at an early gestation and experience no negative consequences. You will now be able to embrace your little one sooner. Consult your physician. Low amniotic fluid can happen at any point during pregnancy, but it tends to happen more frequently near the end. It should be treated right away by a doctor because it could have detrimental impacts on your baby's health. Feeling your baby move less frequent than usual, or noticing fluid leaking from your vagina or are two indications that you should contact your doctor right away. It's best to contact your doctor if you have any concerns at all. There are several therapies, including delivery, that can help keep your unborn child secure and healthy if you do have low amniotic fluid.